Hello friends, my name is Dr. Jaydeep Varinskar. I am an ophthalmologist and a senior vitreoretina surgeon. I practice at Adityajot Eye Hospital, which is a unit of Dr. Agarwals Eye Hospital located in central Mumbai at Vadala West, opposite SIWS College. Today I'll be talking to you about a retinal condition called macular hole. What is this condition? It is nothing but a hole that forms in the very center of the retina called the macula. This is the most important area for vision, and any kind of disturbance happening in this region can affect the vision severely. The cause of this condition is generally not known and is associated with aging and found more commonly in the elderly population. What are the symptoms that a patient comes when the macular hole is developing? The patient will generally start seeing some distortion in the central vision with the lines, straight lines appearing crooked to eventually straight lines developing a gap in the center. So any such symptoms developing in either of your eyes can direct you to go and visit your retina specialist and get your retina checked. The reason I am talking to you about this condition is because it is very easily treatable with surgery, and the success rate for surgery in this condition is almost 90 to 95%. So the success rate of this condition depends on the duration of your problem, that is the macular hole, and the size of the macular hole, and also the configuration of the macular hole. There are various indices which have been developed, which are measured by doing a scan called OCT or optical coherence tomography, and based on this we can predict the rate of closure of this macular hole after surgery. The visual prognosis after this surgery is also good in early stages and smaller macular holes. Macular holes which are large in size and which have been present for long duration have challenges in surgery and closure, but still they can prevent further vision loss if treated on time. The vision prognosis in cases which are very long standing and having some damage under the layer of the retina is not good, but at least one surgical attempt is necessary and can work wonders sometimes in the patient's vision. So it's definitely worth giving it a try. So any elderly people in your family who have developed certain symptoms of missing letters while reading a newspaper, or seeing straight lines crooked, or some missing parts in straight lines, should immediately alert you to get them checked by a retina specialist. And a simple surgical procedure can give them their vision back and prevent further vision loss. Thank you.